Weather forecast from Kate, all coming up within the next half hour.
As concerns continue about the state of the NHS, doctors are warning that some patients face dangerous delays getting specialist treatment through their GPs. The British Medical Association says referral management centres create barriers and take decisions away from GPs. Supporters of the system say it's a good way to manage resources. Our correspondent Jenny Welrond reports.
For Tracy Jeffries, housework is no longer a painful chore, but only because she paid nearly £3,000 for an operation on her leg.
I was in so much pain with my leg, 24 hours a day. I wasn't sleeping properly. I was struggling to get through my work.
The pain was caused by varicose veins. Her GP wanted them treated on the NHS, but his referral was rejected. Tracy had to go private.
If a GP feels that a specialist needs to look at you, then the NHS should be supporting that, and they're not.
Tracy's treatment was blocked by something called a referral management centre. Some are run by doctors, others by admin staff. There were over 13.5 million GP referrals in England last year. More than 2 million of them were screened by referral management centres on behalf of the NHS, a rise of almost 30% compared to 2 years before. 4%, more than 84,000, were rejected, mostly for admin reasons like missing information. Doctors' leaders are strongly opposed to what they say is a blunt form of rationing.
These centres, which are taking a crude approach to scrutinising all GP referrals, can be inefficient, cost more to run than any potential saving, but crucially in the process delaying patient care.
Referral management centres are used by 1/3 of England's clinical commissioning groups. There are 61 of them in England and Wales, gatekeeping what are often expensive hospital-based services. We've not found similar setups in Scotland or Northern Ireland. Those who commission NHS care say the system delivers value for money.
We don't want to squander any money. We have limited resources, so it's really important that resources we have, we spend most effectively and get the best value for our population.
Referral management is, for now, a relatively small part of efforts to manage rising demand, but its use is increasing. That means more GPs, like Tracy's, are likely to see their decisions scrutinised and even overturned. Jenny Welrond, BBC News.
Well, with me now is our health editor, Hugh Pym. Can we say whether or not these referral centres are good for patients?
Well, I think, Sophie, the jury is out. It may come as a bit of a surprise to a lot of people that when they go and see a GP in certain areas of England and the GP says, I'm going to recommend referring you to a specialist to take a closer look, that decision is then vetted by another organisation, sometimes a private company. That's what this is all about. Now, the advocates of this sort of system say, at a time of rapidly rising demand on the NHS's services and a finite budget, there's no harm in taking a second look at these decisions, because once you put a patient into a pathway leading to hospital treatment, it does cost money, and all this is a second opinion. The critics say, though, yes, it is clinically based, but it can lead to delays. It can be an administrative thing, calling for more paperwork, and that's not in the interest of the patient if it delays treatment. And the whole thing is a bit of a bureaucratic nightmare and actually isn't saving money. And I think talking to people involved in the management of these sort of schemes, they say, in theory, it is a good idea. In principle, it's the right thing to be doing, but nobody knows whether it is actually value for money. So the question still remains there.
Our health editor, Hugh Pym, thank you. And there will be special programmes on the NHS tonight on Inside Out at 7:30 on BBC One in England and later on the BBC iPlayer.